So Brodie was born with what we call congenital knee hyperextension, and that's a condition where your knees, rather than bending down like they do in a normal child, actually bend backwards, so more faced up towards your head. It's an unusual condition, but as a pediatric orthopedist, we see these children. All of these children generally come through us for treatment because we're the ones with the knowledge and the expertise of how to take care of them. Now, associated with that condition, because of the way the legs have been positioned when babies are developing, they can also sometimes have some hip problems. So it's important to recognize that both of those problems may be part of what's going on. In Brodie's case, his legs were fairly stiff, meaning that with manipulation or trying to bend the leg myself, I wasn't really able to get it past a straight position initially. However, if you look at kind of what the medical literature tells us, we know that many kids with this condition can be gradually stretched into a proper bent position with the application of casts. And that's what we decided to do for Brodie. So about once a week, we casted his legs, gradually bringing the knees down into a more and more bent or flexed position.
When he was born, when we first saw him, we knew something wasn't right. His legs were pretty much around his face, and they would only bend about halfway down. At first, they told us there that they didn't know what was wrong. They thought his legs were on backwards, but they said that they were getting a pediatric orthopedic doctor to come in and talk to us as soon as possible, and she would be able to give us some more direction. About 14 hours passed before we saw Dr. Hooker, so in those 14 hours, the worst thoughts went through our head. We just didn't know. But we were so tickled just to have him. We knew that whatever happened, we would be fine. But when Dr. Hooker came into the room, our family was there, and she had x-rays done before she came in. And she just right off the bat said, with some work, Brodie is going to be just fine. We never questioned her. She seemed so sure of what she was saying and what she was doing and her treatment plan. So it was just instant relief. And so we are so thankful for that. And we're so thankful for Mission Children's Hospital of having such great doctors that they do. But through their hard work, through all the resources at Mission Children's Hospital, the physical therapy department, 6 months later, he is perfectly fine, and we feel so blessed.
I don't think that you can underestimate or really appreciate how much exactly what you said is true, that it really is a team effort. I mean, what people don't see is the behind the scenes work. You know, Shaylin would be on the phone with Mom at midnight, you know, because Brodie was having a tough time and he was crying or upset or couldn't settle, and they would together brainstorm through, well, what can we do? How can we get him more comfortable? And it's that kind of putting the patient first and doing whatever it takes that makes Mission Children's Hospital and all of the employees here and part of the team here just an amazing place to be.
It does. Even when Brodie was doing physical therapy, Julie was great. Every day after Brodie had his therapy, she would call me and ask me how he was doing. And I have never gotten that any other place. And even when Brodie had to go get his ultrasound done, they didn't make me wait 2 days, or they didn't make me wait a week until I saw Dr. Hooker. They brought a doctor in immediately and went over the ultrasound with me to let me know this is what's going on. And then I saw Dr. Hooker the next day. But it was always nice because they just really put him first. They put us first by letting us know what was happening with him. And we just really appreciated that. And you just don't find that everywhere.